Okay, I think we're going to go ahead and get started. I just want to thank everybody for attending this week's webinar on how to make your EHR adoption a success. My name is Jeff Pickett, and I'm the Training and Marketing Coordinator for HealthPOINT, South Dakota's Regional Extension Center. Today we're experimenting. We're going to do something a little bit different. I'm in Madison, South Dakota, and Holly Ahrens, our presenter, is in the midst of doing an assessment at one of our partner locations, and I don't anticipate any problems, but you never know, so we are going to proceed that way. Today's presentation should not take the entire time. I think last time's presentation was right around 35-40 minutes. Today's will probably stay somewhere in that realm. Today's presenter is Holly Ahrens. Holly is HealthPOINT's clinical manager, and she oversees our team of clinical IT specialists, like she's actually doing today. Holly's got a very diverse background. She was the Director of Quality Management at the South Dakota Human Services Center, where she was responsible for health information projects, including adoption and implementation. She developed and administered the Quality Improvement Program for the facility, conducted workflow redesign projects, acted as quality advisor for all their facility projects. She's also been a facility risk manager, privacy officer, has supervised the admissions department. She's been involved with patient services, medical records, and utilization reviews. So it's plain to see that Holly knows what she's talking about. And with that being said, I'm going to turn the presentation over to Holly today.
Well, thank you everybody for sharing some time today. And I think I know most of you on the call, and good to see all of you, and thanks for spending your lunch with me today. What we're going to talk about is a really important step in the process of adoption of an electronic health record. And if you were on the call last time, or the webinar, we talked about some initial things that were really required for an adoption plan for an electronic health record. What we're going to talk about today is when you really make that commitment to the project, you have an understanding that this is definitely going to be a transformation in your organization and how you do business. So planning for this is going to be a big transformation for people. You have to have a plan, and being successful in that plan is going to include workflow analysis and redesign. Now, the keys to optimizing workflow are very important, and we're going to discuss some of those, and those will be analyzing the current processes, process mapping, obtaining clinical input, finalizing the documentation, identifying opportunities, implementing new workflows, and analyzing, refining the processes. Okay, we're going to give you a couple minutes to just look at this picture and everything that's in this picture. It's hard to take it all in, I know. One of the questions that came to my mind immediately when I saw this was why? Now, this is the best of 80s hair and possibly 70s, though, with those glasses and that mustache. And yes, he's holding a bird. She has a rifle with a bayonet and a scope. Now, this was probably a picture they had taken at Penny's or Sears and prepared for extensively of what they were going to have in this photo. In actuality, this is from a site called Awkward Family Photos, and it's appropriate for one reason. We all do things that seem foreign to others, and I think when you look at this picture, it may seem foreign to you, right or wrong. But it's the way humans are. We do things for a reason. So when we look to optimize workflows, we have to go in, when we look at our own organizations, you have to be that outsider and have an outsider's perspective. And you continuously have to ask the question of why? Why? Why are we doing these things? Now, this couple, I don't know, after a while, they may be able to explain the rationale behind this picture, but I highly doubt it. Let's move on to analyzing the current workflows. Now, analysis is very difficult sometimes. Analysis is going to require you to look at your processes at both a macro level and a micro level. So at the macro level, you're going to have to identify the processes that are going to be impacted by the EHR. Some examples of those, and you're going to have many more, but this is just examples. Appointment scheduling would be affected. Lab result management, chart data migration, billing and accounts receivables, patient encounter documentation such as super bills, and also prescription refill calls. These are very typical processes that are majorly affected by an EHR. So as part of your plan, you're going to have to list these processes, and like we said, at the macro level. Then you're going to prioritize which ones you're going to begin with first. Now this gets into the micro level. Prioritizing is also going to include asking the question of how this process adds value to your organization. Now this is not an easy question to ask, and sometimes the reality of this is you may have to eliminate processes altogether because they do not add value to the organization. Okay? When you are trying to make those decisions, always base your decisions off of your mission and vision statement for the organization that will help you in decision making. So once you have identified those processes, determined their value, then you're going to start looking at these processes at the micro level, and you're going to ask, who are the people that do these processes? These are the people, and they are the best resources to tell you how this process is supposed to be done, how it is actually done, and then what needs to be done to improve that process. Once you have those people in the room and you're able to start interviewing them, what you're going to do is ask them to describe this process in a step-by-step manner. And when I say step-by-step, I'm talking about the very tedious steps of where are the decisions made, what decisions, if it's a yes, what happens then, if it's a no, what happens next. When you take that information, you're going to put it into a flow chart, and having someone who is familiar with process mapping and flow charting is very important. There are different tools and keys that you use when you are flow charting or process mapping that really show where decisions are made, if it's an input, if it's an output, if it's data entry, if it's a form. So it's not just simply boxes and circles. There are true meanings behind the shapes that you use and the types of arrows that are also used. So yes, you could have someone who has a little bit of knowledge, but the preference is to have someone who is trained in workflow and process mapping. Now this is a really tedious step, and I've seen it skipped many times in workflow redesign, but it really does pay off in historical data as well. If you're process mapping, you're able to show this process before the EHR, after the EHR, and then when someone tries to ask, well, why do we do it this way, you can actually show the history of why changes were made. Once you have, once you have done some process mapping, you're able to get some input from people who this process affects. So you've identified the people who conduct the process, but then you also want to listen to people who this also impacts. So there's probably going to be some clinical people that you need to get input from. So do this in a step-by-step manner. You go through the steps of the process and identify who is impacted by each step, and then speak to them on how the step impacts them. People are your resources, and you really have to put a lot of time into talking to people and identifying those steps in the process and how they are affected. So you've gotten analysis done, you have process mapped the process, you've gotten some clinical input. Now you have to make sure that you've gotten all that information and you want to verify. So now you have to go back to those people that do this particular process and verify that what you have documented is accurate. So go through that step-by-step process map with them. And most times they will, you know, if you've done your homework, they will say, yes, this is how it works. But make sure that you give them the opportunity so that they know they've had input into this process. All right, moving into identifying opportunities. So once you've obtained the verification of the complete process map, begin to analyze where waste is located. Now when I say waste, I mean steps that cause either delays, increase in patient waiting times, stoppage of the flow of information, or stoppage of a patient in the flow of the office, or simply where communication drops altogether. An example would be a lab result. Let's just quickly go through, and this, you know, this may be a typical or a non-typical type of lab result scenario, but I have seen this happen. A lab result has been ordered or has been sent to a reference lab, and the reference lab will send that back via fax. Now in this particular office, the fax is located in the business office, which is down the hall from the front desk. So the fax machine is checked on an as-needed basis. If the business office workers see that a fax comes through, they'll walk it up to the front desk and place it on a clipboard in the nurse's station. Okay, that clipboard, by policy, must be checked by a nurse and a physician no less than once per shift. So just from there, and I don't think we need to go any further, we can probably identify a few areas where you're going to see some waste. And first is that fax machine being located in a spot that doesn't have ready access to the providers. When the fax comes to the fax machine, there isn't anyone that is picking up that information and forwarding it immediately. It's on an as needed or as someone walks by the machine. Next, when someone places that result on a clipboard, there is no alert that tells someone that there's a result that needs to be reviewed, signed, or a patient called back. Now the office policy requires that someone needs to check that clipboard at least and no less than once a shift. Now how do we guarantee that they haven't already checked it during that shift and then the result is placed on the clipboard after they've checked it? So you can see that there is a lot of waste and a lot of delays in the processing of this lab result. So let's move to identify and implement. So you've identified the waste. What you have to do at that point is begin brainstorming with those people that are part of this process. You have to brainstorm on the possible alternative solutions. Now you can use several different tools for this. You can use the failure mode analysis and think about every way that this process could fail and think of alternatives, or you can just use a straight brainstorming session, list the resources that you have available to you in terms of, let's say, an EHR could be used, a new fax machine, anything that could possibly be used as a resource. Okay. Now you have to realize that with EHR capabilities, you have to understand what the EHR can actually do before you do this workflow redesign. Because once you get to this step, you have to know what the EHR is capable of. So you can't make assumptions on what your EHR will do. I think we all would like it to be the all-encompassing, golden egg to all of our problems, but in reality, EHRs do have limitations. So understanding the capabilities and functionality of your EHR is very important. So when you're rewriting your process map with these new resources, you're going to include them or line out the old processes or the old steps that cause waste and write in the new steps or the new resources. Okay? Now, understanding why the changes were made in that process is very important, because you're going to have to present this to people who do the process, people who will be impacted by the process, and also probably to administration. So you're going to want to make sure you have good documentation of why you changed the process and how that this new change adds value to the organization. Also, you're going to have to be able to track this change for success. You'll have to be using a quality improvement model, and probably the PDSA is a good one to use, where you're checking and making sure that progress is continually being made. So let's revisit our lab process. Now, if the EHR was adopted and used for this process, it may look something like this. Your lab is received via an interface with the EHR. An alert is sent to the ordering physician that there's a lab to review. And that alert could be one of many ways. There could be an alert when that physician logs in again to the EHR. It could be an alert on their mobile device or PDA. But some type of alert should be sent directly to the ordering provider. Then an alert would be placed on the patient's electronic health record. So anyone that logged into that electronic record would see that there's an unsigned or unreviewed lab. The physician would then go in and check that alert, review the lab, sign the lab, and then make a decision of what would happen next. Do we need to call the patient? Do we need to have another draw done? So you can see just up until that point, you really eliminate a lot of waste that was done in the past. So testing, and Darth Vader here helps us analyze and refine. He finds our lack of testing disturbing. And I think as quality managers and workflow redesigners that sometimes the lack of testing is somewhat annoying, because we put a lot of effort into changing things, and if we don't track the progress or analyze the progress of new processes, then you've really lost the ability to maintain successes. So monitoring, tracking those processes is required. Go back and analyze the process again and you may determine in a few weeks or months, but make a decision, write it down, put it on calendars, make sure you go back and analyze and refine those processes. You may find that the step that you included of providing alert to a physician on their PDA doesn't work because you don't have wireless service or something like that in your facility. So very important you go back and test, make sure that you're analyzing what was done. Now in processes, just a quick tutorial basically that when you are building your documentation, when you're doing workflow redesign, make sure you have 3 key points in every process. You're going to look at 3 particular things. The first thing is the input of the process. That's any type of data, information, phone call, anything that is the input or the information. The next thing is how is that information transformed? And you can see from the previous slide that someone drives up to the fast food window. Their input is their order. They take frozen meat or some mystery meat and transform it into what you've ordered. And this, in a healthcare setting, this is usually done by staff, equipment, computers, anything that has been designed to help with that process. And then the result is the wonderful third part, our wonderful bag full of goodies, which is the output at Burger King, is the burger. So the third part of the process is output. This is the result of the transformation that occurred in the previous step. So when you're documenting the processes, make sure you have input, transformation, and output. So it's really helpful to have those in columns so you know which part you're actually talking about when you're going through the process. Now, we've talked in the past in the first webinar about this, this process of EHR adoption. And I just want to reiterate how important it is that you address in equal parts the three-legged stool of this project. And the first one we have is technology. Very important part of the process. The technology, the infrastructure, the capabilities of the technology, the functionality of the technology is very important. Also identifying that the technology fits the needs of the facility or the clinic, very important. The next is the people, and I think at HealthPOINT we put a strong emphasis on the people and how this change will affect people. So you want to make sure that you're getting input from them. Make sure you understand that the communication that you give to people is extremely important, so make sure you have a communication plan in these projects. Stakeholder management is very important. And also the processes. So under this process leg, you want to make sure that workflow redesign is a #1 priority. Now, we've identified in past webinars that project management is very important and that you need to have someone who is trained in project management and not lump that onto someone else's job because of the enormity of this project. This is another one of those areas that you need to have someone who is trained in workflow redesign and ensure that they understand the importance of interaction with people and technology and ensure that the processes are built correctly. And I know this has been a quick tutorial on workflow redesign. I think that most of the people on the call have had experience with this, and you may want to share some things with the rest of the group, or if you have any questions, let's go ahead and go through those.
Okay, so thanks, Holly, for that presentation. Right now, we just want to open the floor up to any questions that you have. So, on your dashboard there for the GoToWebinar platform, if you have any questions, if you want to just go ahead and type those in, and then I'll turn the mic back over to Holly if I should see any questions that anybody may want to put up there. We'll take a couple of minutes here to get to those. And as we wait for those questions to come in, if any do, okay, wait, we do have one question. Who is the ideal leader for a workflow redesign team? So I'm going to turn the microphone back over to Holly to answer this question. Who is the ideal leader for a workflow redesign team?
Well, I don't think there's ever an ideal. I think there's a skill set that you need to look for in a person. Obviously, if they've been trained in workflow redesign, that would be my first choice. But if you do not have that luxury of having someone trained in workflow redesign, you want to get someone who is able to listen very well to people and what they're saying. And I mean the art of listening. And that is not just, hearing what people say, but it's actually understanding what they're saying about their job and how processes work. And also someone who is very observant, because when you walk through a clinic, you will observe things about a clinic physically that have impact upon the process as well. So the ideal leader, like I said, it's hard to have someone that's been trained on workflow redesign walk through your door, but an ideal person would be someone who is able to listen, very observant, and actually able to facilitate people to talk about the intricacies of their job. So it's really a unique type of individual that's able to do that. Hopefully that answered your question, Jamie.
Okay, any other questions? I'm going to go ahead and proceed to the next slide. But again, if you still have some other questions, please feel free to throw those in. But again, we do want to thank Holly, and this is Holly's email address, holly.aarons@dsu.edu. If you should have any questions following this broadcast, please feel free to send those questions to Holly. And again, I'm just going to go ahead to the next slide here and just let everybody know that we want to make our information reaching out, I guess give it the ability to reach out to as many audiences as possible. So you can find us on a number of different social sites such as Twitter, LinkedIn, Facebook, YouTube. We also have a podcast on iTunes that you can subscribe to. And then also over on Blip TV, you can also find us there as well. Doesn't look like I'm getting any other questions, so I think we're going to wrap up. But I just want to thank everybody again for your time today.